So Masa, what if you had waswasa, but you ignore it, thinking it's just doubt, and in actual fact, it was real? Um, Masa, how would you answer this question?
Yeah, so uh, a lot of the time people have a doubt, but in OCD, people then get a feeling that it's actually real, but that feeling of realness in a real OCD is in actual fact a doubt still. So when Mufti Sahib went through those different levels, often in clinical practice, particularly with OCD patients, we don't tend to look at things too much in depth because they can get a bit uh, tied up into the technicalities. But in essence, sometimes when in an OCD presentation, when people feel it's real, in essence, it's still a doubt. And in the case that Mufti Sahib, for example, gave, say, for example, the person doubted whether he washed his nose or not, and and then he ignored his doubt. Even in reality, if he did not wash his nose, he still would be forgiven by Allah subhanahu wa ta'ala. So even in reality, if the person didn't wash his nose, but he was just doubting all the time, the thing is to ignore the doubt, the prayer is accepted and the person moves on. But even in reality, if the person recited 5 rakahs or recited 3 rakahs or forgot to wash their nose, then Allah subhanahu wa ta'ala is forgiving. So yeah, so that's just to mention. I don't know, Mufti Sahib, if you wanted to add anything to that.
Yeah, exactly. Yeah. So going back to the case of the Salah one, uh, as you mentioned that, because obviously he was an assumption and doubt, he doesn't need to repeat it at all. Again, as we discussed, is ignoring. So there's one particular person asked myself a question that if a person constantly thinks that they have missed a wajib act of Salah, should they read Sadda, should they perform Sadda Sahwa just in case, or would that be giving to waswasa? What you're doing is just giving into waswasa, because if you were to perform a Sadda Sahwa, even though from Islamic ruling, that if somebody performed the Sadda Sahwa without the need, the Salah is still valid, but that's going to end up becoming your habit. You're going to continue doing Sadda Sahwa as, and this is where the principle comes in of ihtiyat, or you're being overly precautious. So you don't need to do Sadda Sahwa at all. As Qasim bin Muhammad mentioned, imdi fi salatik, just continue with your salah. Okay, so the answer is you don't need to do Sadda Sahwa at all. How to improve the recitations in Salah, as I'm unable to get my words out in Salah. I keep stumbling, then waswasa kicks in. And again, the same principle is Allah subhanahu wa ta'ala says, La yukallifullahu nafsan illa wus'aha. Allah subhanahu wa ta'ala does not hold anyone responsible for beyond their natural capacity. So in short, is that you can only try your best. Inshallah, your Salah will be accepted.
Yeah.
Um,
Just to expand on that, so say for example, this question comes up because when we start teaching Tajweed classes, we mention if you recite things incorrectly, then it can affect your salah. So I think the idea is if, as long as somebody, for example, their recitation is really poor, but as long as they're learning at the same time, then the sin is not upon them. But it actually, from a fiqh perspective, is correct if somebody is reciting Quran incorrectly in Salah, they actually do need to work on correcting their Salah. So sometimes I say to my students that as long as you are learning, then inshallah we're under the insurance policy, and we can at least hope to Allah subhanahu wa ta'ala, like we're trying to improve things. And obviously sometimes you can try quite a lot, but sometimes some letters are quite difficult to recite and you might always have some difficulties, but as long as you've given that effort, that's quite important. So yeah, so sometimes there is a reality to things as well, but sometimes the anxiety can just get in the way of somebody actually progressing and learning, which is also important.
okay. Jazakallah khair. So somebody's asked a question. If someone fears their past salahs may not be accepted due to wudu not being done properly, should these be repeated? The answer is no, you don't need to repeat them. One question is that I really want to get married. My parents said I can't until my waswasa is gone. What should I do? It's taken a long time, long to get rid of.
Okay. Yep. I think I could answer that. I actually put it into one of my slides, but I probably skirted over it. But in some ways, uh, uh, I've treated somebody with an actual significant OCD, and 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 he did have difficulties in terms of kufr thoughts, and we worked across that, and he went back to work, and he was doing very well. And in essence, he had that same question, but alhamdulillah, he did get married, and he did come back to me with some support in terms of this talaq issue afterwards. But you only needed about 3-4 sessions, because we were able to think about the strategies he used before. But the thing is that, as we've mentioned throughout this talk, waswasa is something, as mentioned by Sheikh Ashraf Ali Thanwi, that in some ways, waswasa and some level of difficulties is going to be part of our presentation for the rest of our life. Sometimes it can be useful to conceptualize that as an OCD, but in essence, yeah, we'll be waiting all our lives, and none of us would get married if we had to deal with the waswasa. Obviously, if somebody's got a significant OCD condition, it'd probably be worth having a course of psychological therapy to support them with that, and think about the implications for marriage. But certainly, any mental health difficulty shouldn't really be a barrier, although depending on the severity, it can be quite complicated, but there shouldn't be a barrier to sort of moving on in terms of your goals in life, such as marriage.
Yeah, I think, and just added to that is just to re-emphasize this point, as Marsha Tanvi Rahmatullah said, that you will never defeat it. Because waswasa is one of those things that is sometimes, depending on how long it is, you have to obviously look at the longevity as well too. That how long has that waswasa been with you? The longer it's been with you, the longer it may take for it to slowly be manageable and under control. But at the same time, that even sometimes cases that even after marriage, these things can be solved. Because with marriage, if you have a partner, that partner can in fact give you support. He can support and help you to manage. Yes, you can't deal with waswasa by yourself. Sometimes you need somebody there to encourage you. So yes, so even despite that, that shouldn't be a stumbling block for you to pursue your goal or pursue what you want to do. It's like the case with anything in life, in education. So a person cannot stop education because of waswasa. You just continue with it, right? So it's the same thing. So the answer, simple answer is that you should consider marriage, even though if you suffering from waswasa. Now, Dr. Saab, this is a question for you. Is being overly clean hygienic or organized OCD?
Okay, so the simple answer is no, it isn't OCD. Sometimes in normal conversation, we say, well, this person's a bit OCD because they're a bit organized and that type of thing. So the main diagnostic criteria to consider is, does it actually cause the person a significant level of distress, or does that level of cleanliness and organization potentially can cause other people distress if you're tidying up somebody's work desk and that type of stuff, that can cause a problem. But generally speaking, if somebody's clean, tidy and things, if it's not causing them distress, they're not spending hours in a day cleaning, tidying, then we wouldn't consider that as an OCD. As mentioned, some people have got autism, and in some ways that's a lifelong condition. So it's about working with that person, and we wouldn't really treat that in the same way as we would treat an OCD. So yeah, so at a basic level, yeah, I would say that's a no. But a more complicated level, yeah, there could be a different answer depending on that situation.
Yeah, okay. Now, I've got one sister who's asked a question to me directly, because I had a sticky bandage on my foot during the Hajj days due to an injury. I removed the bandage before making wudu, but some stickiness stayed on it. This wudu was to perform my tawaf ifada, which is tawaf bidah, basically, the last tawaf that you do. Okay. I saw it after my tawaf. I asked an alim that, he said it is fine and not to worry about the stickiness. Okay. I still have doubts that my wudu wasn't counted, as I knew the stickiness of the plaster may have stopped water getting through. So what's the rule regarding that? Well, if that alim, a scholar, now one thing you have to remember is that if you've consulted an alim or a scholar, right, and he's already given you the answer, you've already done your job now. Yes? You are no longer responsible for you to continue to entertain the doubt, assuming that, maybe that wudu was not valid. If somebody's already, you've done your job, you've asked the alim. If the alim said that you don't need to worry about the stickiness, your wudu is valid, your tawaf is valid, that is sufficient for you. Okay. And this is another thing I've realized in our fatwa department. I've come to discover that many people, when they come to ask for about the OCD, the first question I always ask them that, have you spoken to anybody else? Okay. And I noticed that many of them, on average, they speak to at least about 3, 4 alims or 3, 4 muftis. Yes. Now you don't need to do that, because even if I was to give an answer, you're not going to be satisfied. You're just going to continue pursuing it. So you're just pursuing the doubt. You don't need to avoid asking too many people. You've asked an alim or a scholar that you trust. If he's given you the answer, you no longer need to ask anybody else. The Sharia does not hold you responsible for that. So the answer to that is, sister, is that that's just doubt. If the alim has already given you the answer, that answer is correct, and no further questions. Okay. There's a question here. Excellent advice. However, people suffering from OCD, they acknowledge what they're doing. However, they continue with the OCD, and the words of advice given, even though logical or clear, they are dumb to them. In your clinical practice, do you test a person's body chemistry to see if all the biomarkers are at the correct level? It needs to be two-pronged approach, not just focusing on the mental health side. So, Dr. Sab, can you answer this?
Yeah, so basically, a lot of even when you go through some of these fatwas and these things, it all seems quite simple and easy, and if a person just follows these things, they can get over it. But in clinical practice, when somebody's suffering from OCD, they can see the logical nature of the things that they need to do, but to actually support them to get through it, it can be really quite complicated, even for a professional to support that person, particularly if the OCD is sort of entrenched. So it does take a holistic approach. So in terms of like the biochemistry, so sometimes looking at the medical side and vitamin D or menopause type uh, biological factors. Also, the use of medication can support someone reduce their anxiety before they can engage in psychological therapy, or sometimes just medication can support somebody to move on. And the truth is, some people with OCD will have like a really long-term OCD. So sometimes it's about accepting that this is going to be part of their life, and they can work towards improving their quality of life and doing certain things and not avoiding things and seeing their friends. But to a certain extent, they are going to have to live with this OCD, just as we would support somebody to live with an autism diagnosis. Sometimes it's about supporting that person to manage the OCD as best as possible and accepting that this is going to be part of their presentation and, in some ways part of their test of life. So some of this like logical steps and things, particularly for a non-professional to support somebody, can be quite difficult when somebody's got a clinical presentation of OCD.
Dr. Mahusab, so one question for you and one question for me. What should
Okay.
someone do if they read the hours once, but it won't distract the thought? So should they keep repeating it? You keep your answer short, please, yeah?
Yeah. So basically the answer is no. So basically in OCD, people will start adding on little bits like asking their mum for reassurance, asking Mufti of the Waheed for reassurance, reciting was multiple times, then reciting calls and then reciting something else. But in essence, it's about not doing all these little extra things, and and in some ways that will make the person more anxious in the short term, but in the longer term, that would be more helpful for them. And sometimes they might need therapeutic support to manage that level of anxiety. But in essence, in the short term, they will actually feel more anxious as part of the treatment process, or as part of overcoming OCD by themselves or waswasa. You will actually feel more anxious in the short term, but you should just recite it once only, or you should and you should try to drop all these extra things that one might do. Okay.
Yeah. So I've got one question here, and we'll end with this, that I stutter and I mumble. a lot also, and I go for my Tajweed classes, but I struggle a lot with my reading. Am I going to be punished for this? A lot of my reading, and I'm going to be but I missed 12 years of Salah. Also, I missed 12 years Salah. I've struggled this with most of my life. I'm very scared of being punished by Allah subhanahu wa ta'ala. I think, like as mentioned, that Allah subhanahu wa ta'ala does not hold anyone responsible beyond their natural capacity. As long as you are attending Tajweed classes and you are trying, then it's okay, alhamdulillah. Then it's okay. You don't have nothing to worry about. I think we'll have to leave it at that now. Jazakallah khair for your participation.